Hello everyone, welcome to US Residency Training and Beyond. I am Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Optional Health in New Orleans. In this video, we will continue with our topic, patient care, good patient care. Uh, I'm not going to give you any shortcuts because there are no shortcuts to patient care. Okay, so good patient care involves good practices, good qualities, and in good manners. So that's something that I wanted to stress in each and every video because that's how we learn things in the right way and take the things with you and practice them in however way you want. But when you're learning, you have to learn the things the right way. We were talking about gathering the information in the morning and rounding on all your patients before you go to the morning report or before you round with attending. It's very important to gather all the information about your patient to see what things going on with the patient and how they are doing. Are there any changes in the patient care? Do you need to make any changes to the plan of care? Because when you go see the patient or the family member, talk to the patient, they're going to ask you questions, or you should give them updates on what's going on. So I highly recommend you do your thorough homework. You try to understand the patient before you go see them. That's why it's also very important for you to have a clear understanding about all your patients under your service. You need to know why they are here, how you're managing those patients, what's going on with each and every single patient. That's why you need to do this thorough chart checking every single day before you go see your patients in the rounds or before you round with your attending. That's very important because you don't want to look like a stranger or you don't know what's going on, because that doesn't look good and they don't really appreciate that when you have no idea like what's going on. Sometimes if patient get information even before you know the information, that looks really bad on you. So you have to be thorough on each and every single patient. Review the charts thoroughly, open the chart, read it, look up all the labs, vitals, medications, managements, any changes overnight before you go see the patient. So during rounds, you might have to make some adjustment to the medications or call in new referrals or put in new orders like labs, imaging, based on your conversation with the patient or the family member. So that's why you have to make a note during the rounds as soon as you come out of the patient room. But some people, some attendings, they like to carry their computer on wheels with them and try to do the orders or notes. I don't like that idea of typing in when you actually talk to the patient or family, because you have to give 100% of your dedication, your concentration towards the patient, the family member. That's highly important. The second most important thing is you have to be mindful, conscious about your time, because you have to go to the next assignment immediately. So that's why your goal is to round, see all the patients, see how they're doing, and explain to them what going on, what changes are made in the plan of care, how that's going to affect their length of stay or discharge. So your goal is to get to see all the patients, because when you start like putting in orders in the patient room or typing stuff in the patient room, because that's going to take a really long time, and that doesn't look good also, because you're not paying attention to the patient or the family member when they're talking. So that's why I don't recommend that you do. If you want to do that way, then what you should do is you should leave your computer outside the room. You go talk to the patient first and explain to them everything, and when you come outside, you try to put in the orders. Or as soon as you finish the rounds, if there are certain orders that have to be entered or things that need to be addressed immediately, say for example we went to see a patient, the patient was so much pain, right? You need to address that situation immediately. One, you have to put in an order if the patient is not already on pain medication, or if the patient is already on a pain medication, then you need to find the nurse and inform the nurse the patient needs the pain medication right away. When you place the order, you don't simply place the order and leave and go to the next patient, because sometimes the nurse doesn't know that you put in like a immediate order, because you have to find the nurse or you have to call the secretary on the floor and tell them, hey, I put in an immediate order for a pain medication for so and so room, so and so patient. please give the medication to the patient. Otherwise, you go after like an hour, the order sits there in the computer because no one really knows, right? Or sometimes you put in like an emergency X-ray order or emergency ultrasound order, and no one addresses it because sometimes they're busy treating or taking care of the other patients. When you put in these immediate orders, you have to pick up the phone or go to the floor, talk to the nurse, find the nurse, or tell the secretary to find the nurse, and make sure that's happening. Again, going back to our wow protocol. So you have to verify the information, we have to act on it, we have to address it, and we have to verify again. So once you finish this wow protocol, then you have to do the CD protocol, communicate and document. So these two protocols are very important. Wow CD, remember this mnemonic. Each and every single time you have to follow this methodology to make sure you address the things on time, to make sure that the patient gets good care. So going back to this wow protocol, so verifying information means when someone calls you saying the dog, the patient is asking for something, you have to immediately open the chart and see what's going on with the patient, right? Why the patient is asking for this medication, or why the patient is questioning about this. Verify the information first. You have to do it by yourself. Either it's like checking vitals or checking labs, checking medications or imaging, anything. You have to open the chart right away and verify the information first by yourself. Act, right? Say now you need to act. That means acting means like either leaving your room, going to the floor to see the patient, or picking the phone, calling the nurse, or picking the phone, talking to the patient family member. Act. Now address the information. Like say now you went to the floor to see the patient, you acted on the information. Now you need to address it. You have to either put in a new order or explain to the patient what's going on, or put in a new imaging or medication, and no, you have to address it. Now verify again. You have to make sure that question or that issue has been resolved or is taken care of. So that means you're closing the loop. So this is the wow protocol. Every time you need to follow this protocol. And then the next is the CD protocol, which is communicate with your senior or attending or the nurse or the patient or the family, or the department who is consulting you or the emergency room. Communication, and then document it. So once it is documented, that means everyone in the care team can see it. Sometimes they don't know, but if you put in the computer, they click on your note, even if it's like 2 lines saying that hey, this patient has in severe pain, so I saw the patient, I addressed it, the patient was given medication, patient is feeling better, right? Simply 2 lines, so everyone will know that okay, it is taken care of. So you each and every time you should follow these rules, follow this methodology protocol to make sure that things are addressed properly, on time, in a proper way. So coming back to our order, so as soon as you finish the pre-rounding, you make sure that any orders that needs to be entered, any consults, anything that needs to be done or taken care of, so on time, before you go to your morning report. This is another important aspect of the patient care is attending the morning report. This morning report is mainly about to discuss any new admissions that came through overnight. So it might be direct admission from department, or admissions coming from the other hospitals, or admissions coming through the emergency room, or sometimes they go to the operation room and come to your floor for admission. So there are different ways you can get admissions overnight. So because these admissions or when happened when you were not there on the floor, because you signed off in the evening, you went home, the on-call physician, the physician might have went to see the patient in emergency, deemed that the patient needs admission to the floor, or they got the patient from outside hospital that's coming directly for admission to your floor. So these are the things that happen overnight. So this morning report is about discussing any of those things that happen overnight, all these new admissions that is coming in. It's very important to have that conversation with your seniors, chiefs, and attendings during that morning report, so they will give you valuable insights into the patient care. You must and should attend the morning report every single day, be there on time and present. So whoever admitted these patients, like on-call resident, will present these patients, will tell why the patient came through emergency, why the patient went to the operating room, or why the patient got admitted to the rehab floor. So they will explain about these patients, they will present their views and opinions, and the chiefs or the attendings will give more insights into how this patient need to be managed, what things need to be added to the plan of care, those kind of things. So it's always very important to be on time, to must and should attend these morning reports. Okay, so with this I'm going to end this video. We will continue with our topic, patient care, in the next video. Thank you for watching my videos. Good luck. See you soon. Bye.